Dr. Edwin Lee, how are you?
I'm doing great.
Good. We have some bad news. You're involved with Clinical Peptide Society. You are a practicing doctor. You've been practicing for several years, and you've been involved in peptides for the better part of a decade, correct?
Yeah, I've been in medicine for 26 years,
Okay.
but anyway, I'm happy to say now we have 3 groups aligned together: International Peptide Society, Clinical Peptide Society, and Dr. Seed's group. So we're all together to fight the common enemy, the
Sure.
FDA, to
So-
save peptides.
So what is the common enemy for people that are just really not educated on this? Because when we talk about peptides from our clinics and from my platform, a lot of people don't even know what it is. Can you give a little rundown of like, what is a peptide? Why is it important? What are people missing? And what has just happened in the recent weeks?
Great questions. So let me just start off. This big battle really has to do with your right to medical freedom, your medical journey there. So whether you want to go alternative or you want to try something different than conventional, this is really at the core issue.
Mm-hmm.
And so the FDA, I can imagine, if they're successful in taking away peptides, then what's next could be bioidentical hormones, and then after that, nutritional supplements. And it's the FDA. I don't know why they're upset, but no one's dying from peptides. And the first peptide that they were upset, which is understandable, was in 2021, and that was during the COVID time. And I don't know which compound pharmacy advertised on how thymosin alpha-1 can cure COVID, which they should never say. But then the FDA got very upset and basically put it on the do not make list.
Sure.
For compound pharmacies. Anyway, to answer your question, what is a peptide? It's a small little protein. It's made of amino acids. Mm-hmm. Some of the peptides we use are natural, that our body makes, and it stimulates the healing process. So, or it can make you look younger. Or it can help your immune system, or help you get stronger.
This is why I look so good at 60 years old.
Oh, that's fantastic.
Yes.
I'm 90.
Yeah, perfect. You know, when you say they're just basically amino acid chains, they're proteins, how can the FDA really say that they're dangerous if they're that naturally occurring, if they're that simple, if some of them are even derived out of our own systems, such as BPC 157? Like, when I go into a little bit of the dark side of this conversation, maybe a little bit of a conspiracy theory route. I am fully in the belief that the FDA and Big Pharma are basically the same thing. Big Pharma influences one, the other one influences them. They're all both tied to the government. Is it possible that they don't want these drugs out there because they just work, because they're an actual solution, because they can't be patented, anything like that?
There's a lot of theories.
Sure.
And anyway, all I know is that the FDA is really restricting 22 peptides since September 29th, 2023, so just recently. And we have something we can do to save it. I'm not quite sure if it's Big Pharma that's pushing it. I mean, we can go down that rabbit hole.
Sure.
But there's another theory is do Big Pharma wants people to be sick so they can use their medications, and they don't want people to be healthy.
We could get tinfoil. We can go tinfoil hats for that one if you like.
But the thing is that the first peptide that I mentioned was thymosin alpha-1, and hopefully I can publish an updated article of over 8,000 people in clinical trials that goes back many, many years ago, and for autoimmune disease, cancer, and with COVID. And a lot of recent studies have been done in China in the ICU with COVID, and it was safe. So it's just one of those things is the FDA saying there's no safety data. And it's like, well, this is one of the biggest numbers, 8,000 patients studied, and it's safe.
Well, there's no safety data that they recognize. They're not recognizing, they're choosing not to recognize it. Is that kind of the case?
It's like, it's really unfair because if they really look at their own data, there are some drugs that are basically approved with very little number, and in the long run, they do have side effects. So the thing is that this one is really safe.
Okay. Well, I mean, a certain vaccine, perfect example that
It was rushed out, yes.
Was supposed to be safe and effective, and it was not very safe and effective. A couple questions. So with the FDA, a lot of these peptides that they referenced quoted insufficient safety data. So when we're talking about safety, we're talking about studies, right? We're talking about human trials, things like that. Are peptides safe? Are they generally safe? I'm sure there's some that are maybe not as safe as others, but from a general standpoint, are most of these peptides that are in the market that clinics like mine, clinics like yours, clinics that are all in these peptide societies, doctors that are in these peptide societies, are they generally a safe method for treating things?
Oh, it's safe. There are a couple peptides that you have to be a little careful with, like CJC 1295. That I think that's the most one that people tend to get side effects, like site injections, but generally overall it's safe. And I don't know anyone that had any severe ill effect. I had one patient had an anaphylactic reaction, but we'll never use it again. But, anything.
That could have been,
and, you know, all your life, and then later have a shrimp, and now you can't have it anymore.
But so. that could have been from one of the ingredients that were in the powder, mannitol, something like. Who knows what it could have been? Exactly. You know, yeah. So, okay, now you're going to be submitting some safety studies and some data.
Yes, we're working with a group of people. It's not just me.
Of course. I
mean,
you are leading this cause, so I want to give you recognition on this.
I'm part of the leader. There's many other people also involved there too, but I think with International Peptide Society and Dr. Seed's group, we're all just, and other doctors and other clinics that can all help out. And also you guys, I mean, you guys have talent out there, sign the petition. We really need a grassroots movement, and we need anger from the public to basically demand to the FDA to say, back off, let's have a meeting and discuss this.
And that's savepeptides.org?
Yes, savepeptides.org. And you can donate. We need money to help hire lobbyists, attorneys, and in addition, to help get the USP monographs for each peptide.
And Aspire Rejuvenation Clinic will be donating to that cause to further.
Fantastic.
Yeah, we're really behind this. We've been already putting this out on our social channels.
That's fantastic.
We even sent out a newsletter earlier this week. I know we had probably close to 10,000 opens on our email, so it was beautiful. So it was a good thing.
You're great. That's great. I have 0 friends on social media because I don't know how to use it.
Listen, I will help you with this side of it.
I don't get the wall.
So another issue they were citing was immunogenicity.
It's basically about, will you later get an immune reaction to it?
Sure.
And
is there any data even showing that, or is it just they're saying there's a possibility of it?
There's a possibility of it.
Okay.
I mean, there's one peptide that you probably know that's on the list, AOD 9604. Did you know that there's one company it was a pharmaceutical company that's trying to make it into a weight loss drug.
Okay.
It's called AOD, stands for anti-obesity. Anyway, a short story is that in the animal studies, they all lost weight. So they spent millions of dollars, in humans try to basically produce data that they lose weight. So they had a nutritionist, they had they had a personal trainer, they had a dietitian to set up the food. Sure. And no one lost weight.
Interesting.
They spent millions and millions of dollars, and they just could not do it in humans. Did it in animals, but in mice and rats, but not in humans. But it achieved something that was really interesting, called GRAS status, GRAS status. That means it's generally regarded as safe, and you could eat it as food. So AOD 9604 has achieved GRAS status in the United States so that they can market it, but they never got that study to show that it can lose weight. But anyway, it has GRAS status, so it is safe, efficacious. I mean, it's safe. So
it's safe, so it can't hurt you.
Safe as food, Homo.
So with the efficacy, we don't really know.
Right.
But you know, there has been a bunch of anecdotal evidence that it causes weight loss. Who knows? It could be placebo effect, but we really don't know about that. Tell me a little bit why certain companies, big pharma companies, have recently, Merck, for example, recently submitting their own applications for versions of things like BPC 157. This is kind of why I get into this conspiracy theory of, hey, Big Pharma wants to kill this market through the FDA, because whether people like to think it or not, and you guys watching, there are Big Pharma executives that go and run the FDA, and there are FDA people that go and run Big Pharma companies. They are more linked than we realize sometimes.
Right.
But, you know, with companies like Merck doing that, does it kind of seem like it's just a monetary push? Like they want to get it away from compounding pharmacies, they want to patent it, they want to blow the price up 10x, because they did the same thing with HCG how many years ago?
HCG, the FDA have always been
Sure.
upset with the HCG diet, so they got what they wanted. They basically got the compound pharmacies to stop making it.
Which I'm not a fan of HCG diet either.
Right, but the thing is that there is like, it's made exactly the same way as compound pharmacy was making it before, but you can get Pregnil or Novorol, which is brand name HCG.
Sure.
But that was always available before the compounded version
Sure.
anyway. It's just that a lot of fertility clinics loved to use the HCG compound because it was affordable for patients.
Well, I mean,
and now it's forbidden, and so.
well, it used to be less than $100. You can get an 11,000 IU HCG.
Yeah.
I just found out this week that the price of Pregnil went up almost 50%. And I mean, so from a wholesale perspective, it is wildly expensive. So from a retail perspective for a patient, it gets crazy.
Yes.
You're talking several $100s for a vial of HCG Pregnil.
You can get it for like $100, and now it's.
Yeah, and now it's
$100 more.
now it's $300 or so.
Exactly.
So, you know, that kind of thing. So when we're looking at the FDA, when we're looking at peptides, is there a true route for this to happen without getting into legal battles, without getting into things? I know you mentioned USP monograms.
Monographs.
I'm sorry.
Yeah, it took me a while to learn the difference between monographs and monograms.
So with the USP capability, will that solve the problem? Can that solve the problem?
Well, one of the stipulations for compound pharmacies to compound anything is if it has a USP monograph. And so, and FDA and apparently USP are not buddies, and it's USP, United States Pharmacopoeia, that's what USP stands for, issues monographs, and it's a process that we're trying to get, so that's why we need money to be raised for each peptide to get approved through USP. How long it takes, I'm not quite sure, but hopefully it'll be quick.
But if the USP can be achieved, then the FDA can't really say anything? Is that...
Who knows what the FDA, they have so many attorneys and so many this and that. That's why we need to have a grassroots movement.
Sure.
And if basically you have 100,000 to 200,000 people upset, they're going to demand a meeting, and would love to have a meeting, you know, open court on TV.
Absolutely.
That'd be great. Let's talk about this. And say, why are you hurting people? Because if the FDA stops these peptides, they are going to harm a lot of people who are dependent on these peptides. And there's nothing in conventional medicine that's making a difference, because I see people who have failed conventional medicine. And these regenerative peptides have been a lifesaver for them. I mean, it's one thing, it's not just that, but other things we're doing in functional medicine that helps them improve. And if you take that away, they have nowhere else to go. They may go down to the internet and look on other sites, but those sites are not controlled. We want the FDA to basically have guidelines so that these peptides are made clean and in sterile rooms, and there's no impurities, and we're 100%, we can trust them. We want the FDA to be there. We don't want the FDA to disappear. We just want them to say, hey, let's
allow some freedom. Let's allow some freedom of medicine.
Exactly. And if you eliminate all this, this is like, they're looking at the wrong enemy.
Sure. Well, they need to be looking at what the gray and black market is doing in these peptides.
Exactly.
Because
they're going to make a killing.
Well, immediately, you know, that's going to be an immediate increase, and peptides aren't going to go away.
And if someone gets harmed with, let's say, on the internet, they purchase it and they die.
Sure.
Forget about peptides.
I mean,
it's just like, but it wasn't controlled. It was like in this unregulated space. Now there's some places on the internet that are, quote, they're doing as best as they can.
Sure.
But I could see, you know, they all of a sudden explode.
Oh yeah.
And they can't keep the demand. The demand's there, but can't basically produce. And
They can't keep the quality more than likely.
exactly,
You know?
quality could be an issue. And if someone dies, or like a group of people die,
Or gets sick, or gets cancer, or heavy metal poisoning, things like that. And that happens in that gray and black market. I've seen it.
yes.
I'm
So it's what I worry the most is that it's going to go down that way. And this has been approached to the FDA before, and anyway, it's like, why are they not being regulated, and why are compound pharmacy being punished?
Yeah, and I know the FDA and I think DEA as well recently went after SARMs. Are you familiar?
Well,
The SARM industry.
the farm industry.
Yeah, in the U.S. specifically.
Okay.
They can't do anything about the overseas industry. That is, you know, is what it is. They'll ship it in. But the national, you know, the U.S.-based SARMs industry, they went after a lot of people. A lot of people caught some felonies over that because they banned it and then they went after the manufacturing. I wonder if that's going to be the same route they take with the gray and black market peptides, because some of these companies are here in the U.S. You know, and they all say, what do they have? The for research purposes only,
Yes.
for animal use only.
Right.
You know.
Their consent form's very explicit.
Oh, great lawyer. Whoever wrote
Yeah.
it was an excellent attorney.
You cannot purchase it unless you
That's
tried
right.
it 1,000 times. Yes, it's research purposes only. Yes, yes, yes.
So with that gray and black market side, and when we're talking about, like, you know, peptides and managing peptides for healthcare and things like that, I assume this can get pretty dangerous. I know that there's not a ton of side effects when it comes to peptides in humans, but if they're not regulated properly, if they are maybe not compounded properly, if they're not clean, we're talking about a lot of different dangers on that aspect. But what about the actual dosing protocols, the way these drugs are used? A doctor, in my opinion, is needed for management of those peptides to even find the correct peptide blends. Because I have people come to us all the time, well, I can just buy BPC 157 online. Why would I get it from you? Well, besides the cleanliness of the drug and, you know, the efficacy of the drug and the way the drug is manufactured, being on a doctor prescribed protocol with it, along with whatever else you're doing, because as medical practitioners, you're looking at the totality of the circumstance.
I tell my patients, you can get it on the internet, but I wouldn't do it myself.
Yeah.
And most, I would say 99.9%, they will not buy it from the internet.
Yeah.
They always say, I want to buy it where you would use it.
Sure.
And they have trust.
Yeah.
So, and that's why the FDA did a great thing in terms of forming the F503A compound pharmacies, sterile rooms. It cleaned up that compounding industry back then, and this is what they do really well. They have to go through state inspections and make sure everything's like for infectious control is up to date and all that. So,
Yeah.
and they get inspected. So this is what we need.
Yeah. Well, I you know, and there's good sides of regulation. There's obviously very bad sides of regulation.
Exactly. So I like the good side of it. And we just need them to back off and have, you know, just some space to breathe.
Sure. Well, I mean, you can't practice as a doctor. You know, my medical practitioners for our clinics can't practice properly if you don't have the tools.
Exactly.
They're literally taking your tools away to effectively treat your patients and effectively help for whatever the case is, for staving off the aging process, for autoimmune disease, for healing,
management.
regeneration, cancer management.
Exactly.
I mean, the one you mentioned, thymosin alpha-1, I remember when they got rid of it, when they put it on the do not compound list, we had, it has to be over 100 patients that were on it perpetually for autoimmune disease. And they're like, well, what am I supposed to get now? They're lost. They have no way of now treating themselves, and that was the only cure they had.
Well, the backup peptide it's called thymolin, and you add zinc to it, but that's also on the list now.
Yeah.
So it's like, this is, when I saw that list, I cried.
Oh, I mean, you're a huge proponent of this. You've been in peptides for a while. You're part of these international communities. This is a big deal. I found out about this when I was in Dubai just a week and a half ago, and I'm discussing bringing our concept over to the UAE and the GCC region. And when I saw that, I contacted the attorney that I'm speaking to out there, who's coordinating this effort in the region, and he said, yeah, we don't care about that. We know where the raw materials come from. They're coming from India, Pakistan. They're like, it's not a problem for us. So it's good, But still, now the U.S. market is going to be completely dry, and you're going to have the EU, you're going to have the GCC region, you're going to have the Asian markets. They're going to be able to get all the peptides they want. So those markets are probably going to explode, where this market is going to kind of dwindle and die unless us, everybody, push against this.
Exactly.
Yeah.
We have to fight as a group.
Yeah,
So.
it has to be a coordinated effort. But podcasts like this and interviews with you, educating people on peptides and what this is, because people don't have no clue. Because their normal medical practitioners don't talk about this.
Exactly.
They probably don't even know what it is.
Right.
So how long have people been using peptides? How long has this science and this area been around, really? I know there's some that are very old.
Well, the most famous peptide that most people and even doctors forget is insulin. Insulin I'm a board-certified endocrinologist, so insulin was discovered in 1922, and then 1923 was available. And so since that time, insulin has saved many people's lives. Without insulin, before insulin, it was in the early 1920s. If your child had type 1 diabetes, you would literally lock them in their room and starve them to death. It was a slow death, because if they ate a handful of cherries or whatever, they go to diabetes ketoacidosis and they die.
They die, yeah.
So they knew that they just had to basically kind of do a slow caloric intake.
Restriction, basically, yeah.
Yes, and no sugar, and for them to survive. So, but it was revolutionary. And insulin, now we look at it, it's nice and clear. Back then, it had a lot of impurity. It was like gray and black, and they didn't know how to refine it, but it got better. And that's how Big Pharma basically, made insulin available. And then, so insulin, it's interesting history, going a little off tangent, but during World War II, if you were on the different side, if you weren't with the Allies, you would have to be a biochemist and try to figure out how you're going to get insulin, because only certain countries had it, and if you're on the other side, you were not going to get the insulin. So they would, thank God it was written in biochemistry textbooks, and they got like some whales, and they got water buffaloes, and basically got their pancreas and made insulin that way. So anyway, hopefully another war doesn't happen here. And
it's looking,
I mean, that's
it's looking a little
unrest, a lot of political unrest, but the thing is that we are kind of at war with the FDA without these peptides.
Yeah. So obviously insulin being one. When did the modern era of peptides start, in your opinion, with the ipamorelins, the sermorelins, BPC 157, the ones that people actually recognize, that understand the industry? When did those come about? Like they've been around for a little while.
Yeah, thymosin alpha-1 was like the early thymosins were discovered in the 70s. But I would say in the 80s and 90s, it started slowly getting popular. I think around mid-1990s, BPC 157 was from Croatia. I have a hard time pronouncing his name. Dr. Pivlock. Probably screwed that up pretty bad, but
I don't remember his name, but that's where my family's from. I'm first-generation American from Croatia.
Oh, Croatia.
Yeah.
Okay. So
that's why I love the drug so much.
BPC 157.
That's my favorite.
But it was all an animal study, so I was like waiting for somebody to publish human clinical trial, and I had a medical student rotate, a pre-med student, and I know the family very well, and anyway, Blake came to my office. Didn't care what I really was trying to teach him. His main interest was, when are we going to publish? When are we going to write? I have this project I did with TB4 and BPC for knee pain, and then later I figured, if it gets better, I should just switch to BPC only, because which one made it, which one helped. So so after 4 patients, I switched to BPC, and I said, just call those patients, and we published the first retrospective study on BPC, and it was safe.
Yeah.
So anyway, so I would say the Russians were really started in the 70s, and they've made a lot of interesting peptides. So like Cmax and C-Lang, and in addition, epithalin was discovered. So I would say in the late 70s, early 80s, they became really popular. And then what's interesting, the bodybuilders here started reading the medical literature more than doctors.
Oh, yeah.
And they got on hold of these BPC, what they could do in animals and tendon ligaments healing.
Sure.
And they go, let me experiment. So BPC has been used in, not in, I would say, in medical clinical trials, but been used on the street, especially in the weight rooms.
Sure.
They always tear their shoulder or whatever, some joints, and inject BPC. So that's old news to bodybuilders.
Well, that's what I'm saying. Like, so when you have these large population groups and all this historical data, yes, is it anecdotal? Does it have the proper placebo test and the double blind, everything like that? Does it have all the proper data that a medical journal would want? Maybe not. But after 30, 40 years of use, I feel like there should be something taken into account. And is it possible for, let's say, a group of doctors, a group of clinics, business owners, entrepreneurs, is it possible for us to self-fund studies like this to actually get this data out there in the right way where it would be recognized?
Well, the gold standard test is double-blind, placebo-controlled, randomized controlled study. So it costs money.
Sure.
And I do some studies in my office, and patients have to pay for the labs. They have to pay for their supplement. And so when people call, they're shocked, like, I'm not paying them to participate. Because it's not big pharma that's basically giving away money for people to get whatever, $1,000 or $2,000 to be in a study. I mean, there's no big pharma involved with this. So it's really, I have a question, medical theory. Will this make you younger? I don't know. Would you like to be in a study? Sure, let's try.
Oh,
That's how I do my.
Who's not going to want to?
But it's not randomized, double-blind. It's not double-blind control, but it's a pilot study just to test the idea, and then future bigger studies, needs to test that idea. But I'm always curious, like, will this thing or this supplement or this technique, help? I don't know. Let's do a study. I don't have any. There's no data in the literature, but let's see if this thing will work. So a lot of theory, but I'd like to test it out and
I think big groups like these peptide societies and different clinics. You own a medical clinic. I own a medical clinic. I'm not a medical doctor. I'm an entrepreneur. I love this stuff, and believe it or not, I actually got into this entire peptide and HRT realm from bodybuilding when I started 17 years old.
Cool.
I studied it through my entire 20s while I was a police officer.
That's great.
So I became.
Yeah, there's a nice article.
There's a couple of them out there. Yeah. So I became somewhat of an autodidact in these peptides and hormones and things like that. With no formal education, and I fell in love with it. This is what I feel like medicine.
You're very passionate about.
I love it. This is what medicine I feel should be. It's really treating underlying issues. It's really looking at the problem. It's using bioidentical sources, or as close to as possible, where I feel like what most of medicine does is a Band-Aid operation. It's treating symptoms, not problems.
It's reactive medicine.
It's reactive medicine, exactly. Where what you do, what I'm looking at, it's very proactive. You know what I mean? We want to actually solve the issues these people are having. So with this kind of ban, will this actually stop research from happening? Can this stop research from happening?
It may stop research happening, but maybe other countries can continue to do research. But it'd be hard to do research if we don't have access to the peptides.
That's what I mean. So
yes,
is this going to restrict access completely?
Yes.
Okay.
If everything is shut down, yes. And it's not the research that I'm concerned about. It's really a continuation of care.
Sure.
And it's my patients, your patients, and every other person that's really been life-saving. What happens if their family member gets sick? And they know that this therapy would work. I mean, why deny them access to to medical care? That's the whole issue. Is access to medical care is the big issue here, and
now with that continuation of care idea, and with the idea of you doing your job and properly upholding your oath as a medical doctor, and with these pharmacies also doing that, can that be the position to fight under? can that be the place where, you know, medical doctors, clinicians, pharmacists, and pharmacies, is that the position that we can all take and say, hey, no, we're not stopping this. We're going to keep doing this. And it ends up in a lawsuit situation where we say, no, this is real medicine. This is what we're doing. I try to look 5 steps ahead of where this can go. And I try to look at what can actually work. I love petitions. I love, you know.
I understand what you're saying, and maybe it will go down to a lawsuit, but it's like going to Las Vegas. If you only have $1,000, you're not going to last long.
Sure.
Versus if you have $100,000 that you brought.
Yeah.
So it depends on how much money we have as a society.
Right.
And we're not big pharma. We don't have
billions.
we don't have deep pockets,
Yeah,
but maybe
yeah.
other people can help us. Hopefully we don't have to go down that route
Okay.
for a lawsuit, because I could see they're going to win, because
They have more money.
yeah, it comes down to who has deeper pockets, and they can just stick it to us, say, you know what, we'll just drag this out until
Yeah.
you bleed to death.
Yeah. Yeah. Well,
And
it's definitely a
and the
tactic.
thing is, let's not go down that route. Let's basically work with our senators. Let's work with our representatives. Let's work with our governor. Let's talk to them and say, hey, let's have meaningful legislation to get this passed. So that's another avenue that we need money for, is to have meetings with our senators, our governors, our representatives that will listen to us. And it's really, what's amazing is for almost 3 years, my petition, I only got up to 1,640, and I've been screaming every month at the top of the mountain. No one was listening to me. It's like saying to the same church choir, same church group, please sign the petition, have your friends. And they, they get tired of you saying it. But I would love to, like once a month I do this webinar for Clinical Peptide Society, and every month I post like the latest testimonials on peptides. I was a vet. I served in the Army. I served in the military. I got injured. Nothing was helping me. And I got on these peptides. I got my life back. It's really touching. Other, wonderful testimonies, like, this is like, I was blind. Now I can partially see with a peptide. So, I mean, how much more? I mean, these are really touching testimonials. And so it's just, I love reading that. So if you're ever depressed, just read some of those testimonials. It goes back a long, long time ago. So, most of these testimonials, they talk about, screw big pharma, screw FDA and all that.
Yeah, abolish the FDA.
Yes, yes.
The FDA.
Chop them all down, chop the heads
yeah.
off, boom, boom, boom. Yes, they're angry.
Sure.
And it is, because it's like, you're really going to hurt. It's just like they want control, but they don't see this down effect where people's lives are going to be in danger.
Yeah.
And why do you want a society to be? Don't you want society just like for Americans to be healthier and more productive, and they can pay their taxes?
I don't know. It goes into two different sides of the spectrum. Do you want them to be productive and lively and strong and healthy, or do you want them to be dependent? You know what I mean?
You don't want them to be dependent.
It seems like they push that a lot.
I guess depends which administration, but anyway.
There you go. Yeah, and it depends on what administration and what the social and political outlook really is. But I mean, look at the food supply here in the United States specifically. Look at the food supply, the water supply. Look at how we treat humanity. Look at the artificial lights. Look at we're tied to these phones 24 hours a day. The blue lights issues that are causing all the sleep problems. I mean, there is so much that is inundating us with toxins. We
live in a toxic world. Yes.
Yeah, but when I go to Europe, when I go to the UAE, when I go anywhere else in the world that does not have all this stuff, and they don't do these things to the food, all this processing is not there, I feel like $1 million. I feel a different person.
Yes. Yeah. Me too. So.
Yeah. So when we look at it that way, I don't know. Does the government, does the FDA, do they want us to be healthy? Do they want us to really truly be healthy? Do they want us to really truly thrive? I hate even thinking of the fact that they wouldn't. It just seems like it's such a backwards way of thinking. But it all seems like it's all profiteering to me. It all
if you
seems
follow
that
the
way.
money, yes. I mean, Europe, they don't approve any single drug until they know long-term side effects. Whereas in the U.S., like it's not just drugs; it's the chemicals.
Sure.
So, I mean, in Europe, they're very, very conscious because every country is so close to one another.
Yeah.
And they want to make sure that it really doesn't have long-term side effects, and they look at safety. Versus U.S., it's like, yeah, any chemical you want, and then 50 years later, oh my God, this can cause cancer.
You get the lawsuit news or the lawsuit commercials.
Yes.
If you have taken X, please call us for compensation.
Yes. So that's a whole subject with epigenetics, and I love epigenetics, how environmental toxins can turn on or turn off, turn on like cancer genes and turn off your protective genes. So anyway, there are peptides can turn on good genes, and yet that's going to be taken away too. So this is just driving me crazy.
What are the top 3 peptides, in your opinion, that are out there for health, for wellness, for anti-aging, whatever, your top 3? If you had to choose 3 peptides, only 3 in the world that you could keep, what would they be?
The first one is epithalin, is my favorite peptide.
Okay.
Because it can help your body become younger, and it can help it self-divide and turn on good genes, turn off bad genes. I've seen so many. I really respect the Russian data, the 15-year studies they've used on epithalin, lower mortality.
And that one's gone now.
It's on the list.
It's on the list.
Yes. The second peptide I love is GHK copper, but it's available topical. It's the injectable that's going to be taken away. So that's like one's available the topical because there's a patent on it, and Dr. Pickard basically he wrote the foreword for my peptide book, and he's the one that discovered GHK copper. He has the patent on the topical GHK, and it's used in almost 1,000 different cosmeceutical lines.
Sure.
So you can still use GHK copper, but the injectable ones, I think, has a lot of other great benefits in turning on good genes and turning off bad genes.
Okay.
And the third peptide I really think is critical is your immunity. So thymosin alpha-1 is critical. So, but I mean, it's a combination of like if you had to take away a peptide and like on the list you cannot get like say BPC injectable, I'm going to miss that too.
Yeah.
So
it's hard to pick 3.
yeah, so it'd be epithalin, like GHK, BPC, and thymosin alpha-1.
And thymosin alpha-1. So if we had to do 4, so we'll just go with the top ones. I'm in pretty high agreement with you. Thymosin alpha-1 was a huge hit to the market with antiviral properties, antibacterial properties. I mean, it's almost
so cancer management.
Drug.
Yeah,
it's almost a perfect drug, you know, which is crazy.
Yeah, I tell all my patients have that available just in case you get sick, because you can just draw up, inject, and be healthy the next morning.
I use
if you use it quickly.
I used it during the pandemic.
Oh yeah.
Never got sick. You know, anytime
Perfect.
I even had a little bit of
Very
something. Good. Yeah, thank you, appreciate it. I have a few vials left over. Maybe the BUD is a little bit expired, but it'll probably still work.
That peptide has been studied. It's they actually, I know the guy. He lives in Australia. Put thymosin alpha-1 in his car, and it's really hot in Australia. 2 years later, they checked the basically efficacy.
Still say viable. Still say efficacy.
Over 90%.
Wow.
So it's has a long shelf life.
So the US
they have to put a date because of
they have to. It's regulation.
And then I argue with my wife about canned foods. Like it doesn't mean it's expired. It's just the best tasting. You can still eat it.
Everybody will laugh at me because I'll be the guy where it's like, there'll be a gallon of milk or something in the fridge or something, anything, yogurt, whatever. I don't care what the date says. I'm going to smell it. No matter what the date says, I'm going to smell. I'm like, it could still be good, right?
Exactly.
The date's kind of like subjective.
Well, dairy, you have to be careful.
I know, of course. But I'm that guy that's always going to smell it, even if it's, shows it's expired. Where other people, they see the date, it's done. It's over with, Yeah.
The smell test, yeah.
With the peptide stuff, that's good to know that thymosin alpha will stay okay for a while because I have more than a few vials at my house, and
Oh yeah.
I definitely stocked up before they got rid of that. What would you tell people? What is the top things that everybody watching can do to help this fight? Where can they find where the fight is being led from? How can they help? What is the best thing for them to do? I understand signing the petition is great. Donating money is going to be better. So tell everybody where they can help the most.
Those are the top two things, but if you have access to any governor, representative, senators, just reach out to info@dredwinlee.com and or reach out to your clinic there, and if you'll communicate, so that'd be great.
Yeah, AspireRejuvenation.com, or you guys can find me directly any social media platform at Tomo Marjanovic. If you guys follow this podcast, if you guys follow me on social media, easy to get in contact with me. But yeah,
any lobbyists that are basically who's into peptides, that'd be great to work with. We don't have to explain what a peptide is from the very beginning. But anyway, we need help. So,
is there a monetary goal, and do we have is the organization 501c3 or anything?
Yes.
Okay.
I have a non-for-profit organization. I started about a couple of years ago, and I raised money through my office and through other people donating. But then after a while, my accountant didn't know how to handle this. I got IRS, some issues, letters, and then I found another accountant that's like 150 years old, and nothing gets done. So I was going to close it because no one was donating, and I was losing money rather than getting this. And then I was ready to transfer the money that I raised to another non-for-profit organization, but anyway, this thing came out, and anyway, I'm going to donate it to all the lobbyists that we're going to find that's going to help protect us, and for the USP monographs. So anyway, I reopened it, so you can go to savepeptides.org. It's a non-for-profit organization, and it's really about saving peptides.
That's great, and we also just.
And if you know an accountant that can do for non-for-profit organization, please contact me.
I might have somebody for you. We'll talk after the podcast is over.
Very good.
But yeah, and we also started our non-for-profit this year called Operation Optimal Foundation. We're focused on military veterans, first responders that are needing services like peptide therapies, HRT, things like that they can't get from the VA. The VA we know is kind of a nightmare when it comes to anything peptide related, HRT related, anything like that. And it seems to be a huge benefit to, just like you said, some of these stories you told me.
Oh, it's amazing. Oh.
They're completely able to turn their lives around, even from a mental health standpoint. Depression, anxiety, PTSD can start to subside as well from these peptides and HRT.
You should talk to Mark Gordon. He's been doing veterans for traumatic brain injuries for over 10 years.
So yeah, we'll link up with
and
that.
And I taught peptides in his workshop.
Perfect.
And one interesting story was during that conference, one retired colonel from the American Air Force wanted to have a fist fight with me because I kind of was talking about how peptides help the brain, but I was talking about peptides and joints. And he got so mad, he stood up, put his finger at my face and goes, "You are going to ruin the orthopedics careers." It's like, this is a good discussion. Yeah. It's like, why can't orthopedics learn how to use these peptides and give another option rather than steroids or surgery?
Exactly. Well, they make more money with that. So
but give another option.
Sure. But, just like we said, if you follow the almighty dollar, unfortunately in medicine, it always ends up back there where, gratefully we have people like you. Gratefully we have all these doctors in these different peptide societies and hormone societies, A4M, WorldLink Medical, all these different areas that are really looking at taking care of the patient. Not so much looking at the product, looking at the patients over the profits, and that's going to end up making you money as well. It's just going to be I could sleep better at night. You could probably sleep better at night.
Right. Well, anyway, thank you again for
where can everybody find you? Where's your business? Where can everybody find you? Do you have social media, or do you use it?
I just do email.
Just do email. Okay, so what's your email address?
The office email address is info@dredwinlee.com, but you can find me at dredwinlee.com. I'm in Orlando. We're really neighbors.
We're neighbors. He's right down the street from our
Literally,
office.
we can walk like 2 minutes and we're right there. So this is amazing.
Yes.
Anyway, go to savepeptides.org to learn about how to save peptides. You can please donate and also sign the petition and give it to your friends and family. Put it on social media. Love for this to get viral. So just pass along. So it's really growing. So we went from 1,600 people signed, and this morning it's up to over 4,000 in a week. So I'm like so happy. It's just like
wonderful.
You could see it growing.
Wonderful. I hope we had a little bit of assistance with that, with putting out our newsletter and putting this out on my social media. I know most of my friends were signing it, people that are close to me. I am going to commit that Aspire Rejuvenation Clinic is going to donate to SavePeptides.org. We're going to keep putting this out there. We will have all the links down in the description for this. We'll have the links in the social media posts. I really appreciate you coming on. I know you have to get back to work, and you have to go treat more patients with these amazing drugs, and I hope that we can save peptides.
Oh, that'd be, I think we can.
Fantastic. Thank you for coming on.
Thank you, Tomo.